Hello, hello. Welcome to Effective Cannabis Conversations. We're certified cannabis health coaches, educators, medical professionals, scientists, pharmacists, and patients come to share their knowledge and experiences to educate on the health benefits of medical cannabis. Today, we'll be diving into navigating medical cannabis and harm reduction. And joining me for today's conversation is my colleague, Yakima Palmer. If you want to be notified of new conversations, take a few moments to subscribe and hit the bell icon so we can keep you updated. Hello, I'm Debbie Wimberly, the founder of the Effective Cannabis newsletter, and we are honored to have Yakima Palmer with us today. And she is our guest editor for our harm reduction issue this month. Hi, Yakima.
Hi, Debbie. Nice to speak with you today.
It's nice to have you. If you wouldn't mind, would you please introduce yourself by telling us a little bit about you and how you came to use medical cannabis and how you've incorporated it into your own health plan in life?
Yes. So my name is Yakima Palmer. I am a holistic wellness practitioner. I've been and a cannabis educator. I've been a cannabis educator for over a couple of years now and have been doing consulting services for clients. I've actually started cannabis recreationally at the age of in high school, I would say. But I really started using it in 2013. My son was killed, and it actually impacted me on a mental level. So I used it to help me with PTSD and just to get through everyday life. During that time, I started having chronic pain. So I actually got me a medical cannabis card and became a medical patient for my chronic pain, and I have been using it daily.
Sorry to hear about your son. My heart goes out to you. Say you started having chronic pain and you got a medical card. Did you ever entertain using opiates or prescribed medications for that pain, or did you just automatically go to using cannabis?
So I did start using like ibuprofen. I was given Vicodin a couple of times, but it was very irritating on my stomach. It was causing me other problems and wasn't actually helping me with the pain. So I discontinued those pain medications and I started using cannabis daily to help me with that chronic pain.
And was your doctor supportive of you switching to cannabis to manage your pain?
No, honestly, I didn't tell my doctor for a while. I was afraid, of course, of the stigmatism of, why are you taking cannabis? This is illegal and all these other questions behind it. So I didn't tell my doctor that I was taking it actually until recently when I did start feeling comfortable and became a cannabis educator to talk to my doctor so that they are aware of how cannabis is actually helping me relieve my pain.
And are they supportive now that you've been able to explain that to them, or are they still a little bit reluctant?
Different specialty doctors are supportive. It just depends on the specialty, but my chronic pain doctor was supportive, but you can tell the look on their face like, oh, okay, if that's what makes you feel better, then go right ahead. But it's just that look that they give you like, okay, whatever.
I fully understand that myself because I was a prescribed opiate user for over 2 decades. And when I was told because of the opiate crisis that we would no longer be providing you with your prescriptions, I had to find alternatives, and I did visit pain clinics and a number of doctors to try to get help. And they didn't even want to entertain the idea that I might transfer to cannabis, and that was in 2015. So I'm hoping we're making some progress in this
Yeah.
area, because this is really important, especially with the opiate crisis and the number of overdose deaths that are happening because of fentanyl and different illicit drugs that are on the street.
Yes.
And that's not to even mention the number of people that are committed suicide because they don't have access to any quality medication now that the opiate crisis has occurred. So there's a whole lot of things that are happening in this realm that really do need to be addressed. So
I
I
totally
think that it's really important. I understand that you've worked in the mental field for quite a while. And have you had experience within the mental facilities and stuff with these with drugs, and how do they handle it? And have you seen a transition from traditional methods, or are we still to something more progressive, or are we still facing the traditional methods?
So yes, I did work actually on a psych unit for about 3 years as a mental health counselor. And I've noticed that at the first of every month, I always saw the same patients come in that were drug abusers, taking a lot of heavy opioids, and actually to see any changes, no, I have not seen any changes. To me, it just seems like it was getting worse because they were coming in to get help, but were giving additional medications to just suppress the problem for the amount of time that they were there. But when they left, they were back to the original problem that they came in for.
And that addresses the thing that I talk about a lot, because it's like we're not addressing the issue, the underlying issue of why someone is turning to, whether it's prescribed or illicit drugs, to manage something. And I think it's important that we start realizing we need to, just forcing someone to reduce and get off completely, just be abstinence, is not necessarily a good treatment, because we're not addressing what brought them there to begin with. In my own personal experience, I used to be at 240 milligrams a day of Oxycontin, which is a high dose opiate. And I'm on 0 now. And that's because I've been able to utilize cannabis and introduce it to my endocannabinoid system and actually relieve what was the underlying issue, which is a short-circuited central nervous system that caused me to have pain. So I think that this is an important conversation, and that we start addressing the underlying issue. Do you have any figures about how often somebody would come back in? How often or quickly they return back to the clinic?
Yeah, I always had some repeat patients that I could expect to come in every month or twice a month or every other month because of their chronic issue with medications. And it was just a repeat cycle over and over with the same patients. And I've even held like big conference, meetings with all of my patients, and everyone just had the same issue. And it was the fact that even they explained, I can't stop coming here because no one is really helping me. So they have expressed their concern of wanting the help, but not getting the treatment I believe that they really need.
So that brings us to the topic of harm reduction, which is a whole new way to look at addressing addiction and dependency on medicines. And it encompasses a set of practical strategies designed to protect an individual's health and well-being while acknowledging the reality of their choices. And when I say the reality of their choices, is what they have available to them to try to address their underlying problem. I don't think that people just wake up any day and decide, I'm going to be a drug user today, or I'm going to go to the doctor and ask to use opiates today. There's something that's underlying there that's forcing you to do that.
Yes.
So rather than demanding abstinence, harm reduction aims to engage and support individuals who use drugs, helping them make safer choices and reducing potential harm. Have you ever been able to approach anybody about this and trying to utilize this within the mental field?
Yes, and not even just the mental field, just for just pain control overall too. I've talked to many clients that want to actually get off of the medications, but their doctor didn't have any other plan for them but to continue to put them on those medications. So I've actually helped educate most of my clients to use cannabis as a resource to assist them in getting off of those opioids.
That's awesome.
Yes.
Go ahead, sorry.
Oh, no, it's fine. And it seems to really help them. Just explaining to them, you don't really always have to smoke it, just, explaining all of the different ways that they can use it to help them with their pain. And a lot of people are older patients, who still believe in that stigma of, it's marijuana. Well, no, I do understand what you're saying, but there are alternative ways that we can help you alleviate some of this pain and get you off of these opioids that you're taking. And they're really open to wanting to do it. It's just that there's no one there to really explain to them what options they have.
Well, I hear you on that. I think that's one of the biggest things that we're trying to battle now, and why we're having this conversation and why we're addressing this in this issue, because learning that I had an endocannabinoid system and that I have receptors in my brain and all through my body that cannabis can react with and manage. I used to live in a pain of 10, even at 240 milligrams a day of Oxycontin. It was not reducing my pain. I'm now at a pain level of 3 and using cannabis, and it's truly amazing. And it's learning how to use cannabis correctly with your body and your receptors, because it's unique to everyone. So it's not a cookie cutter system, which is what we've been using for years. It's a cookie cutter system. Just do, the traditional forms of just abstinence, and then everybody will be okay. And that's not true, because we're not addressing the issue. So
no.
So incorporating cannabinoids is like a really big thing in learning how to deal with addiction and dependency. And I don't really separate the two. I went through years of doctors telling me at 240 milligrams of Oxycontin that you're not a drug addict, you're just dependent upon it. And until I started to reduce and go through the withdrawals and everything that happens, I realized I'm no different. Just because the doctor prescribed it versus whether I bought it on the street didn't matter. My body depended upon it and was craving it. So when you go to try to reduce it, your body's going to react violently to it. And it's not a fun place to be. So do you know of any current scientific studies or research and the importance of the role of using cannabinoid therapy for reducing medications and illicit drugs?
So I did review some research studies that there was a study from the University of Massachusetts, and they did a survey for 510 veterans. And from those veterans, 90% of them stated that they were using cannabis on a regular daily basis. And 69% of them said that it has reduced their pain over 90%. And they've continued to use it to help them not only with pain, but also with PTSD, anxiety, and depression that they've actually been experiencing too as a veteran.
That's amazing. And we see that there's lots of research that's been done since cannabis has been legalized across the US and other countries, but in the US itself, we see that there is a major reduction in the amount of opiates that are prescribed. There was an article that was put out in January of 2023 by the Health Economics Journal, And it was based on going back and looking at the people that prescribe, like pharmacies and stuff that prescribe the medications, and the reduction that they've had, and the states where cannabis is legal, that they're not prescribing as many opioid type drugs. So we're seeing a reduction. I always have to kind of put a caveat on that, because a lot of people are being denied access to treatment for medications for pain because of the opiate crisis that we've been living within. So we have to take that into consideration. There was another study that was conducted by scientists out of Indiana University that they found that 15 CBD derivatives were tested in different concentrations to find that they could reverse the effects of fentanyl overdoses.
Nice.
And research found several to be effective in reducing fentanyl from binding to the receptors, and even at even incredibly low doses. So, I mean, those are results that are really promising in trying to address this. And at the same time that we're using cannabis or cannabinoids with these receptors, it's also addressing the pain levels and some of the underlying issues that cause people to turn to these drugs.
It does. It does.
So that's good.
And I also want to state too that in order for our research to continue to keep going, we have to inform our doctors that we are using this, so that they can know how it's affecting us. If not, then how is the research going to get done if we don't say anything?
Totally agree with you. I know I was very frustrated when I started trying to figure out how to use cannabis, and I was trying to get doctors to help me, and they would just shut me down. They didn't want to hear me. They said, if you're going to use cannabis, we won't treat you. We will have nothing to do with this. And so I'm very vocal about using cannabis for my pain, and that I don't use opiates anymore. But it's something that we have to really stay focused on, because doctors need to understand that this is a really, truly good treatment, whether it's your doctors in a rehab setting, whether it's doctors in your office when you go to see them. You need to be honest about this. So yeah, that's a really good point.
And also, Debbie, I also do medical record documentation and review charts and provide physician education. So during my review of looking at this documentation for pain clinics, I noticed that a lot of the doctors are writing in the medical records that some of their patients are taking cannabis, and that they have reduced the amount of pain medications that they are giving them. So me seeing this in medical records is wonderful, you know, to know that there are some doctors here that are helping patients get off of these medications, and asking them, you know, go, you know, see about getting a cannabis card, or we're going to take you off of some of these drugs because we know what it's causing you, and we know that your pain level is not changing, so let's help you other ways. So there are pain doctors that are assisting patients to go get a medical card to get them feeling better.
That's absolutely wonderful. That's what we want to see happen across the board, because I think that our goal is to see that everybody is living the best life possible.
Yes.
And no one wants to live in pain, I promise you. And no one chooses that. And regardless of what you're using or how you're using any substance, there is an underlying issue. So I applaud any doctor that is doing this. I think we need to give them recognition, and that we need to, you know, help them know it's okay to do this, and help excel them so that they can share this with other people. Because this is just slowly starting to change mindset. We have a long way to go, but that is truly amazing. And it makes me so happy to hear that we're seeing this in medical charts now, because it's something that I make sure is in my medical chart, no matter where I go. Talk a little bit about the impact of cannabis on our health, and how I've had no side effects from using cannabis whatsoever. All I can say is it's created good. I can actually sit here and talk to you today, which I couldn't have done back 7 years ago, because I was so sick. So from your own experience in using cannabis or cannabinoid therapies for your pain, would you say that you've had any symptoms or any conflict with using it with your body?
No, I haven't had any problems since I've been using it. I must say that I did start using it as to smoke cannabis, but I stopped because to me it was I just didn't like the effects that it was giving me from smoking. So now I take it as a tincture and as an edible. And not only is it helping my pain, but it actually helped decrease my blood pressure as well. So it's been helping in many areas with creativity, just focus. So not just pain, but cannabis works in the many other ailments that we have too that can help because of our endocannabinoid system, and it helps balance out those receptors.
Well, and I think that most people don't even know that we have an endocannabinoid system. I find it interesting when I even talk to someone that is a cannabis user that they don't even know that. So, I mean, we still have a lot of educating to go on that. I don't think, in general, they don't teach that in medical schools. It's not taught in our biology classes in our schools, and it's a system. We're all born with it. And it plays an important role in keeping everything in harmony. So when one thing isn't working, something else is out of balance, and it just really plays a big role. But I think it's really nice to hit home on how, especially if you're dealing with chronic pain, there are so many other things that happen. You get high blood pressure, you have anxiety, you have depression, you can develop PTSD. There's a lot of other issues that happen with that when you develop chronic pain. And it addresses those and helps with those as well. So I think that's a really important part of this conversation, is that it's not just one thing that it affects everything.
Everything, yep.
Let's talk about withdrawal symptoms for a few minutes. And I'm sure within your work you've seen the violent effect of withdrawals coming off medications. I've experienced them personally, so I can speak from a personal. But why is it so important that we manage those withdrawal symptoms, and how does cannabis play a role in that?
Cannabis helps play a role in it because it helps stabilize the body, to me. Because if you take someone off of a drug immediately, it can actually have adverse effects. So cannabis actually helps play a role in trying to stabilize the effects from the medication that you're taking, so that it can help, how can I say, balance the body so that you won't have to take as much of that medication, if I'm answering that correctly.
You are. And this is an area where I've done a lot of research and study, because being an opiate user and then being forced off and going through the violent withdrawals, finding myself laying in a hospital fighting for my life, I had to understand how this works. And one of the things that I discovered is that when you give your body any drug, an illicit or a prescribed drug that's an opiate, you have receptors that it binds to or blocks. And when you don't supply that, if you cut that off, your body reacts to that violently, like, I need that, because it becomes dependent upon it. It really does become dependent upon it. So having something like cannabis to help you deal with the nausea, the vomiting, the headaches, the anger, all of the emotions that go along with being reduced or completely cut off of your medication is really important. I'm not going to say that it completely eliminates all that, but it helps you manage it and be able to say, okay, I can get through this. Because I used to work in hospitals, and I've worked through many detox clinics. Watching someone go through detox is not pretty. It's not fun. I personally never thought I would be there doing that at some point in my life when I used to work in a hospital. And understanding how cannabis works harmoniously with those receptors and helps relieve that pressure, it's going to make the person be more successful in actually decide to never go back.
Some of the challenges I think for therapies could be not knowing how much to take. because, people are given the cannabis and not told how to take it. So I think that's a big challenge in trying to find out, as they say, the sweet spot, to see how much you need for you, to help with whatever ailment that you're going through. So it could be just knowing how much you need to take, what kind of cannabis you're actually taking, looking at the different terpenes, the strains, looking at if you need THC along with CBD, and how that, some people can do a 1-to-1 ratio. Some people need just regular THC. So just, to me, I think talking with the cannabis expert will help understand, more of how it will work for each person.
Very much so. And I think that it's really important to understand that a lot of times when people start thinking about using cannabis, they don't have that direction. They don't have that. They're just, they're actually desperate and looking for something to provide them with relief. And one of the things that a lot of time gets overlooked is other pharmaceuticals that they may be on. It's one of the things that I always think is a really important
Exactly.
thing, and that we need to make sure we're telling our doctors about this. How about challenges that may arise with family members and loved ones that aren't supportive with cannabis? Can you speak to that for a few minutes?
Oh, yes. I have many clients that even are church members that are so afraid to talk to their other church members of their use of cannabis. They are in so much pain, and they need to take this cannabis, but they can't talk to anyone else about it because they feel like they would be, that they would look down on them, or why are you taking this? And, just start shouting out different evil things to them. I do have clients also that are not, that do not communicate with their families because of the use of cannabis. And they feel like, well, that's evil and you shouldn't take it because it's not really helping you. It's making you sicker. But, to me, you have to do what's best for you. And if your health is very important to you and you do not want to take drugs that are harming you even worse, why not use cannabis? Because there's very minimal side effects to that. Of course, if you're taking other medications with that, you do seek out a physician to see if you have any interactions. But as far as family members and people, I would say use your own best judgment and you do what's best for you and what makes you feel great.
I always find this part of this conversation interesting, because no one wants their family addicted to anything. And we have plenty of research now that shows that you really don't ever get addicted to cannabis. No one dies from using cannabis because we can't consume enough to the level, because your body just gets rid of it because of the way it works. It works very differently with your body than pharmaceuticals. We are resistant to that when it actually could be the very best thing that they could do for a loved one, to help them, assist them in this process. And that's the problem that we find a lot, is that people feel left alone with no one to help them and no support. And just going in and out of rehabs or joining AA or something like that, we need much more support than just that. We need someone in our life that is supporting, that we can lean on and talk to. So I think that's really important.
I totally agree. Totally agree.
So when we talk about the legal or regulatory aspects of using cannabinoid therapies, how could we go about addressing and changing this as a community? What are things that we could do
to make it, say the first part again,
to provide insight into the legal regulatory process that we have for addiction and how we're managing it. What are some of the things that we could do to enlighten and encourage and make change? Because it takes change from a lot of us to make this happen. What are some things that we could do?
Definitely education. We need to educate our providers, our all providers, healthcare providers, mental health providers, anyone that's providing services to patients and clients need to be educated on the importance of this plant and how its uses are greater for our clients. Because a lot of people, as we know, are not aware of how important this plant is for us, and that the medications that we're taking is actually harming us. So to understand how we can alleviate some of the prescription drugs and the people suffering from lots of health issues can be off of a lot of prescription drugs by incorporating cannabis use to, help them get off a lot of the drugs. And it starts with education. We have to educate our community on the use of it and how important it is that, but I believe it just starts with education, educating our people to understand the importance of this plant.
It does. Education is where we all should be living on this topic. That's why you and I became educators. That's why you and I became coaches, I believe. Not just to help, I always say I could have gone off and just done whatever and not taken this task on, but I think I see the value and the importance of this conversation. And I know how important it is, especially when it comes to illicit use, when it becomes to prescribed use, and understanding that this plant has the ability to make a difference in your quality of life and bring you, I always say I want to live my absolute best life possible that I can.
Yes.
So for wherever you set, it can improve that if you learn how to use it, engage with your system properly. It comes from education. It's not just go ask somebody to put something in your hand like we've done for years with doctors, clinics. It's learning how to communicate with your body, learning how to listen to your body, and addressing what is, because everybody's body is unique, which is what we want, because we're all unique individuals. So I think that's good. So how do you feel about educating about this in public schools for our younger children?
Honestly, I haven't thought about with the younger kids yet, but I know they need to know. I don't
went out with you, but and the reason I did is because I think that's where we start the education, is at that age. They need to know they have an endocannabinoid system. They need to know the important role it plays, and hopefully we can get to the place where younger children are learning to take care of their own health, because who knows your body better than you? No one.
Yes.
So if we can start educating, this is one of the things I really strive for, is educating people at a very young age, start listening to their body and listen to the cues of something not being right, instead of just relying on the medical expert or someone else to take care of us, because that's like handing them a set of keys and say, go manage my life for me. And we need to be more involved. We talk about diet, we talk about exercise, we talk about, good job, good relationships, those things, but we really don't talk about how to be your best partner in health.
That's true. That's true.
We teach our kids to tie their shoes.
Yep.
We teach our kids to walk. I think we can teach our kids how to be their best partner in their health, and that's something I strive.
Well, I totally agree.
So I didn't mean to throw a curveball at you with that question.
Because they don't know, and it has to start somewhere. And you're right. The younger that they know, how to take care of themselves, it'll be, they live actually longer and understand what's going on in their body.
Right. Being medically trained and not learning about the ECS and knowing that I had one till I was like in my 50s, and then starting to take control of my health was truly an eye-opening experience. And it's like, why do we wait till we get so sick to start addressing these issues? Or we, not dealing with the underlying issues of what's causing this. So I think that's an important thing that we need to start educating at a much younger age than what we do. We've been educating for years, just abstain, don't use cannabis, how harmful it is. I think we need to reverse that and show how helpful it can be.
For you. That makes sense. Because when you think about it, when you tell kids, stay away from this, don't use this, don't use that. But now let's tell them why we said that and how this will enhance your endocannabinoid system and how you need to pay attention to your body. That's great.
Yeah, I think it's a really important piece, and it's something that we don't hear talked about often. And I know it's because it's underage, 18, but I think that I don't care what age you are, you're born with this system, and it plays an important role in your life. Now, whether you incorporate cannabis or not, that's a whole different thing, but we need to be educating the value of this system and the role that it can play. And, we know that there's a lot of people that are using cannabinoid therapies for other treatments for their kids. So, I think that we need to be teaching this in our schools. So how do you envision, we're going to end up with this question, how do you envision the future of cannabinoid-based harm reduction? I mean, if you could paint that picture of what you would like to see happen, how can you see that developing and becoming particularly promising?
I can see more providers, healthcare providers being trained and educated on our endocannabinoid system, because we all know they have no idea what this endocannabinoid system is. So I think starting out, if they're highly trained, learning about the endocannabinoid system and how different medications affect the body and how cannabis could balance those cannabinoids in our body will make life a lot simpler. I think it would help with our crisis, the opioid crisis. It would eliminate a lot of drug abuse, drugs maybe even coming into our communities, and people having a lot of access to that because now they know that there is cannabis that can help them with a lot of their problems. So cutting down, that will help cut down a lot of medication problems, more addiction, more hospitalization because people are addicted to this drug, to these opioids that now they don't need these. So it'll cut down on the hospital inpatient visits. I see that our world would be a whole lot better health-wise once we get acclimated to know how cannabis will work for our ECS system.
I want that world. I think that would be awesome. I think that it also is because doctors don't necessarily want to go back into learning everything that it takes, because you and I both know what it takes to learn about this system and how to actually know how to engage with it. So I would really like to see doctors and medical schools and educators in the pharmaceutical world and the medical world partnering with coaches and educators.
Yes.
Because we've taken the time and are taking the time to learn about this. And I think that if you could have that liaison between the patient and the doctors helping to communicate and share that information would be a really good way for us to move this forward. I think that using that model in rehabs and detox centers would be very helpful. I think that we, having someone there that fully understands how this works, what they need to do when somebody is having, we're so accustomed to either abstinence or we can take medication at a specific time. And that's one of the beauties about cannabis and using it for your own system is you can use it when you need to. You're not going to overdo, you're not going to overindulge. So when you're having those withdrawal symptoms, being able to have that something that you can immediately use at that moment to help deal with the problem is vital in my mind. So I think having just someone on the clinics and in the rehabs, mental hospitals, whatever it may be, someone that's there that is an expert in this that could help and could guide everyone, I think that would be a really good place that we could utilize that.
I would love to see that. It's coming. We're staying hopeful. It's coming.
It is, and it's because you and I are doing what we do. It's
Yes.
because we're trying to get out there, and there's a whole bunch of us that are out there trying to do that. And that's one of the things we need to keep doing, is talking about this and sharing about this, because it truly does make a difference, and it's important because everybody's life matters. And I would like to see us all move this forward. So I appreciate you joining me today. Thank you very much. This was a lovely conversation. I hope that our listeners walk away with this with a newfound information that hopefully that they can share with someone else that might be struggling with anyone, whether it's prescribed or illicit drug use, because it is a valuable tool. Do you have any last comments you'd like to make before we sign off?
I just appreciate you bringing me on, Debbie. I have been so supportive of the Effective Cannabis newsletter and what you all are doing to provide this education and information to people is absolutely needed. Continue to do this. I think the more people we can get on board and understanding our ECS system and understanding the power of cannabis and how it can help us will help make life a lot easier and better. Thank you so much.
Thank you so much. That's very, very heartwarming. I appreciate you that this is just a passion of mine and a mission of mine to educate, because it's made such a difference in my life and given me a life I never thought I would have. And
Yes.
I believe everybody has the right to know what is possible.
Yes,
So
I agree.
I appreciate that.
You.
Thank you. So thank you for being our guest editor this month. You can find Yakima. There will be a link below to her information, to her website. And you also will find her listed in our directory. So if you would like to contact her and talk to her, please do so. Thank you. Have a good day.
So thank you.
Okay, bye.
Bye-bye.
We so appreciate you dropping in. Your time and support are invaluable as we strive to educate and advocate for the transformative potential of medical cannabis. Remember, you have only one health and one life, and no one lives them but you. Let's continue this journey together. Subscribe and hit the bell icon to stay updated on our latest conversations. Your comments and engagement fuel the dialogue we need to create change. Until next time, stay empowered and keep exploring the wonders of your endocannabinoid system. Stay uplifted, stay curious.